June is Uterine Cancer Awareness Month, and the thing you may not know is that this, uterine cancer specifically, is becoming gradually one of the fastest growing forms of the disease in Canada, with over 8,000 women expected to be diagnosed this year. So let's kind of focus on this for just a second, try to explain it, and try to help if we can. Dr. Shannon Salvador is president of the Gynecologic Oncology Society of Canada. She is also a practicing gynecological oncologist and is on the line. Dr. Salvador, thanks so much for being with us this afternoon. And let me begin, first of all, before we even get to it becoming more gradually a more common cancer, what exactly is uterine cancer?
Hi, afternoon. It's great to be here. So uterine cancer is when the inside of the uterus actually starts to grow a cancer. It's in something called the endometrium. And most women, if they're presenting with this type of cancer, present with a really obvious sign, especially if they're postmenopausal. They start bleeding again. And as we know, most women postmenopausal expect definitely no more bleeding. So it gets their attention real quick. And usually they start asking questions.
So that's the earliest warning sign that there's something you need to follow up on is the bleeding itself?
Absolutely. And so typically this cancer is more of a postmenopausal disease. It usually happens to women later in life. And so they get a big warning sign there. And any bleeding whatsoever, you should absolutely get in to see a family doctor. If someone's premenopausal, it's a little bit more confusing sometimes because we can have abnormal bleeding as you get towards menopause, but definitely it's something to bring up with your family doctor if you ever run into a menstrual cycle that's definitely not normal for you anymore.
What about in terms of tests? So we know we have screening programs for other kinds of cancer. Is there anything for uterine cancer?
Yeah, there's no screening program per se. Unlike cervix cancer, we can do HPV pap testing and things like that. This is something that you have to be aware of, that there is an issue so that you can bring it up. Now, luckily, it's very easy to test for, because once we know that you have an abnormal symptom, the first thing you should do is get a referral over to a gynecologist who then can do some very simple tests inside their office to be able to determine if you have this type of cancer.
And then beyond that point, in terms of treatment, when you're first being diagnosed here, what does that play out as? How does it work right now?
Yeah, that's a great question. So luckily, this is a cancer that if we identify early, it is often curable, and typically curable with even just surgery alone. Because if we find it inside the uterus, hasn't had a chance to spread, then a simple surgery that can be done even as a day procedure with minimally invasive surgery can cure this disease. When we run into trouble is when the disease isn't identified earlier enough there. It's a very aggressive one that spreads quickly. Then it goes into your lymphatic system or into your blood system. Now we're running into a problem where we have to use systemic treatments. And our systemic treatments for endometrial cancer can be very challenging.
If I can just, trying to imagine how this plays out. So let's say you've come across this bleeding issue. You realize now you need to go see somebody. Treatment is necessary. Do we go through, is it an MRI? Is it a biopsy? How does it progress?
Yeah, that's exactly it. We do a biopsy. That can be done in the clinic.
Right.
Very easy to do. Once we have the biopsy, based on the types of cancers that it can be, sometimes, yes, we will arrange for MRI imaging, CT scans. We're looking to see any evidence that the disease has spread. At that point in time, you'll usually see a gynecologic oncologist, someone like myself, because our surgeries, when we do them, we not only look just at the uterus, but we'll actually do some specialized procedures where we often look at the lymph nodes in the pelvis to ensure that you don't have any disease that's spreading.
And beyond that, in a case where you diagnose this, does it ever come to the point where when you talk about treating it, where radiation is necessary or involved?
Absolutely. So if we see evidence that it's gone to lymph nodes, or other pelvic organs, we'll often say, hey, radiation can probably help in this scenario. Once we're outside of the pelvis, it's usually a systemic problem. And then we're looking at chemotherapies. And in our more recent treatments, we're starting to add immunotherapies, which is a wonderful type of treatment that's really added to our ability to treat metastatic disease.
When we talk about different cancers, and we've had discussions on the show with different doctors, over the past year or so, for example, talking about why there's a prevalence of this particular cancer or colorectal cancer in young men, which seemed to have come out of nowhere. This was never a problem with younger men before. Does that fit this for women as far as as uterine cancer is concerned? I mean, the notes say it's gradually increasing. We typically talk about breast cancer as far as women are concerned. Do we know where this is coming from? Do we have any idea why this is increasing?
Yeah, there's two splits to this disease. There's an increase in older women, but that is also because we're probably living longer and living healthier. So we actually just get to a point in time where we can develop these types of cancers. So we see that group is increasing their rate of cancer, which makes sense. What's interesting is that we see an increase in the younger demographic, the younger women, so women who are premenopausal, which again, like I said, becomes challenging for us to be able to diagnose because people naturally think, oh, the abnormal bleeding might be due to something else,
right.
So it can get missed. We think that group is going up, unfortunately, because obesity rates are going up in Canada. And there's challenges with infertility. And these are both things that can put people at risk of developing this type of cancer. When you have a lot of estrogen flowing around in your body, which does go up in obese situations, this puts people at risk of developing this type of cancer. So we have this real split in the age groups.
I just wonder, though, for someone, you mentioned about the older sort of cohort. I understand that. You're right. People are living longer. With respect to the younger, and this is the same sort of parallel to men, young men who we were talking about with respect to colorectal cancer. If someone is at that stage in their life, a younger person here, and, figuring, well, this is not serious to bleeding, this is something I might expect, at what point does that person have to wake up and realize, you know what, I need to do something about this. This is more serious than I think.
Yeah, so especially if you ever hit to a point in time where there's daily spotting, that should never happen. You shouldn't have daily spotting, and it should be investigated. Whether or not it's endometrial cancer, there's something going on that you really need to have a look at, right? And then also if you have bleeding to such an extent that you're going through multiple pads a day, you're getting dizzy, faint, anything like that, that is definitely also a situation you've got to get in and get that looked at.
So I would simply ask what the message would be to people listening, to young women perhaps, or parents listening to this, trying to suggest to their kids, at this point, you need to take this seriously. Is that something you have found in your practice that people, kind of surprised when this happens? Absolutely.
Abnormal bleeding like this always needs to be looked at, whether it's something related to a cancer, whether it's endometrial, cervix cancer, because this is also can be a prime presentation of cervix cancer too, or there's a hormonal imbalance, something going on that you're going to need assistance with to try and help you. These are all reasons to really make sure your voice is heard and get in to see someone.
I just want to go back to one thing you said. You brought up obesity as a potential factor here. We know, of course, now between things like, Wegovy and all the other drugs now, the GLP-1s, would a recommendation here be if you are, in fact, obese or getting that way, that you consider doing that as part of a treatment here or not?
Actually, that is a very good question. And we are studying this to see if people who are on these types of GLP-1 drugs actually have a decrease in their endometrial cancer rates, because there is a significant correlation between obesity and these types of cancers. So I'm very excited to see what these studies are going to show. And this is potentially a good reason to get on one of these drugs.
Okay. All right. I would just ask as we wrap up, for people who might want to know more, is there a website? Where can people go to find out?
Actually, it's interesting. Our colleagues at the Ovarian Cancer Canada just opened a new site for endometrial cancer at Well. It's fantastic. So I really encourage people, you can go there to look for information. On our own website of the Society of Gynecologic Oncology of Canada, we also have information on all the disease sites there too.
All right. Doctor, thank you so much. Very much appreciate your time today.
My pleasure. Take care.
Take care. Dr. Shannon Salvador. And as I said, you might want to just be aware. It is sadly increasing, right? More commonly now, cases of uterine cancer for women. So just be aware. It's Uterine Cancer Awareness Month.
Listen, and you're there for heart-wrenching knockouts.
World's biggest stage.
And breathtaking triumph. 2026 FIFA World Cup. The knockout stage. Every match, every moment. Listen on TSN Radio. Join the Globe on the road to the July 19th final. 2026 FIFA World Cup. Stream it all live on TSN Radio. Available on iHeartRadio.